good evening, depending on where you are in the world. I can see we have over 50 participants so far in the first of 3 EduPal webinars. You're all very welcome, and thank you for signing up and for your interest. So first of all, a few housekeeping rules. If you have any questions, please could you type them into the Q&A. If you hover your cursor to the right at the bottom of the bar on Zoom, you can see Q&A, and you type your questions in there. We have 3 speakers this afternoon. The talks will vary from 10 to 15 minutes with 5 minutes for questions after each. And the total duration of this webinar will be 1 hour. We ask that you fill in the evaluation afterwards, and you will see from where you entered Zoom on your internet browser, there is when you go back to that, there is a questionnaire, and you just follow the links there, please. It would be great if you could give us some feedback. EduPal has been a labour of love. It's a project we have worked on together. Several of us from many countries around Europe. We would have loved to have met everybody during this Congress in Bucharest, but unfortunately we're now unable to travel. But we hope that this will be a very, very good second best, if not better. So it means you don't have to travel through airports, and you've saved a lot of money, so that's great. EduPal, as you can see from one of the slides on your screen, it stands for a palliative care standardized curriculum, and it's translating international recommendations into undergraduate palliative care curriculum. And those recommendations were the European Association for Palliative Care recommendations. And this first webinar is going to start with a presentation from Dr. Stephen Mason from Liverpool in the UK. And I'm going to let Stephen introduce himself because that's easier for me as chair. So I'm going to pass over to you, Stephen.
Okay, thanks. So let me just share my screen. This one. Okay, so hi everyone, I'm Stephen Mason, and I'm from the University of Liverpool. At the Palliative Care Institute, but for this project I've been almost seconded to the AIIHPC to kind of help with one of the work packages in EduPal, and I'm just going to give a little bit of an overview of the work package 1, which is development of the curriculum and the reasons behind why this is part of the EduPal project. So let's see. So we know that palliative care is a global challenge. Reports like the Lancet Commission report in 2017 highlight the challenges that there are at caring for people at the end of life. And within the Lancet Commission report, identifying that almost half of the deaths that occurred in the year of their survey involved serious health-related suffering, which I think they equate to about 6 billion hours of serious health-related suffering. Equally, the WHO estimate that 40 million people each year require palliative care, and only about 14% of those people get it. And I guess that gives us the question, why? You know, why is this the case when palliative care practice has advanced incredibly well? Our ability to control symptoms and to deal with patients' pain and to provide spiritual and psychological support to patients has increased incredibly. But what are the challenges? And I guess this is partly the reason why the WHO at the 67th World Health Assembly proposed this resolution to make sure that palliative care education and education to help clinicians provide that care and support to patients should be enshrined in all undergraduate curricula within medicine and within nursing and with all associated healthcare practitioners as well. But it's still a challenge. We know this is from the Carlos Centino's AIIHPC Atlas from 2019. And again, amongst the range of information they were looking at, they also looked at education. And from their survey of 55 countries in Europe, they identified that only 9 of those countries is education about palliative care mandatory. And in 35 of those countries, no medical school has more than 20 hours education in terms of palliative medicine. And this leaves us with this question, well, why is there such a dearth in the development of palliative medicine? And I guess there are a number of reasons for this. The WHO themselves said that actually access to palliative care, good palliative care, the biggest barrier to that is a lack of healthcare or appropriately trained healthcare professionals. But equally, we know that there are people who are trying to provide palliative care and want to improve practice, but to do so from a standing start is very difficult when there's no infrastructure to support people to do that, and where there's already a very crowded curriculum, and how people find space within that curriculum to make sure that palliative care is part of everybody's skill set. So this in part was the reason that Daniela put together the proposal to submit to the Erasmus Plus funding stream to develop this international curriculum. And it's not just the development of a curriculum, it's a series of support measures for that curriculum involved in lesson plans, appropriate online material, approaches to train faculty and how they develop that curriculum, how we evaluate and measure that going. So this really was the crux of the AIIHPC project, which was submitted in 2016 for funding and awarded in 2017, which was great for us. And again, you can see here on the slide the links to the partners who've taken part of this. So there is the Romanian group, and there's a much wider Romanian group involved in this project. The University of Aachen with Professor Frank Elsner as part of that group. Antonio Noguera from Carlos Centino's group in Pamplona, and Piret Pal from the medical school, the Paracelsus Medical School, and then there's the All Ireland Institute, which Julie Ling's kind of been involved with, but also with the EAPC as well. So the first meeting we had in Brasov back in January 2018, and that's Brasov in the corner you can see up there. It was a bit different in January than it wasn't as sunny, but it's a beautiful place that I can recommend. If you get the chance to go, you should go and have a look. So we had a 2-day meeting to kick off the AIIHPC project and look at the different objectives that we needed to achieve. First amongst those was really thinking about the development of the curriculum, and we had a bit of a morning looking at how curriculum can be developed and what are the processes behind that. And then we engaged in the process to develop the AIIHPC curriculum. So the first step of that was taking the EAPC recommendations and looking to review those to see if there was any update needed. So the EAPC recommendations have been published in 2013, and that was an update from an original publication of documentation, which was in 2007. So our task was to review critically the recommendations for undergraduate curricula and see if there were any omissions, or see if there were new items that needed to be added, or whether there was items within the recommendations which needed to be elaborated. So how we did this was we had 22 academics, clinicians, ethnologists, people, experts in palliative care from different professional backgrounds in the room to look through these recommendations. And those 22 people were split across 4 different groups with different themes to review the recommendations according to the theme that they were engaged with. So what those groups did was they reviewed the recommendations, and then we all recommenced as a group, where each group presented their recommendations on updates to the curriculum to the wider group. And we followed a form of consensus methodology to check what was thought about the changes and the updates to the recommendations. This was then fed back to the individual group leads, who then again took away the thoughts and again came back to the group in a separate process via email to again review and update the recommendations. And what we ended with was a set of updated recommendations to guide curriculum development. So step 2 in the process was then taking those recommendations and translating those into an active curriculum. And how we did this was we developed a matrix for the groups to complete. And within that matrix, there was key items for people to work with. So each group had to take one of the updated recommendations which fitted with their theme and develop an applicable and transferable learning outcome against that recommendation. From that learning outcome, they then developed specific learning objectives to address knowledge, skills, and attitudes or personal competencies. And also then they were asked to think about teaching plans and how those objectives may be met by different learning and teaching activities. Also how they would be assessed, and also what resources would be needed to support those. So this is quite a lengthy process and led to quite a large matrix. So this is an example of an early example of the matrix in terms of our development. And you can see here, this is from the psychosocial and spiritual aspects theme. So here you can see in the right-hand column, you can see this was the AIIHPC updated recommendation. And then from this, the groups had to develop their learning outcome. And then from that, the associated learning objectives. And you can see this one hasn't been completed because, as I say, this was the matrix still in development. But then also what the learning modalities were for that and potential ways to assess this. So this took a very quick overview of this, but it took quite a bit of time to do this. And again, we had the process of consensus methodology to try and develop this, where when the matrix was updated, it was then sent to the work package leads, which was myself and Daniela. And then we reviewed this and then sent this back to the wider group in a number of iterations to make sure that the final version of the curriculum was something that we were happy with. We also sent the curriculum document that we developed out for external peer review, and that was sent to all the AIIHPC board members, sent to all the members of the AIIHPC reference group for medical education and training, and also to other experts in the field that we thought would provide us with some useful feedback. And we did get a lot of useful feedback, which did help shape and change the curriculum document. We had feedback from 27 different people and from 17 different countries. And again, the feedback we got identified some additional learning outcomes. There were some challenges to what we had put down in terms of learning outcomes. So one was how we differentiated between palliative care and palliative medicine. We initially had paediatric palliative care as a potential learning outcome, but it was thought that actually paediatric palliative care probably needed its own curriculum due to the special issues in terms of dealing with paediatric palliative care. We added in palliative care for minorities as well. There were a number of challenges which were also noted. So the curriculum is nominally a 72-hour curriculum. And again, feedback that we received from the peer review group was that potentially may be a challenge, particularly when we think about the feedback from the AIIHPC Atlas, where a number of countries have less than 20 hours dedicated to palliative care training. So there was issues around that. There was also issues in terms of the balance of the curriculum and the hours ascribed to certain areas. So we bumped up the hours for symptom control, for prognostication and for care of the dying, and took some of the time away from other areas such as dermatological care. So this is what we have now, and I guess this is what we're here to disseminate and hopefully give you a chance to have a look at, which is the Palliative Care Undergraduate Medical Curriculum. This is available on the EduPal website, and again, as Julie alluded to there in the introduction, we've published this as a paper. We submitted it to the Journal of Palliative Medicine, and again, they have allowed free access to the paper, which has just been published for the next couple of days. So again, you can review that paper there. And I guess we have a number of opportunities with this curriculum. I guess now we have the curriculum, it's hopefully there to provide a platform for further engagement and potentially for those people who are striking out and trying to affect their local curriculum and provide guidance to how palliative medicine can be integrated within curricula. And again, the curriculum itself may act as a benchmark for actually what training is being developed across Europe, and is something that people can actually look and review their own curricula within their own medical schools to see what is being achieved and potentially what may not be being achieved. There are a number of challenges, of course, with integrating any curricula, and again, we've documented these in a larger review of the curriculum, such as the timing of training and when should this be integrated into the curriculum. And again, there is some limited evidence that actually later on in training is probably better than earlier, once medical students have had enough clinical experience to contextualize their learning. And again, there is that fight within the curriculum for space. It's, medical curricula are incredibly busy, and actually the opportunity to find space within the curricula to integrate palliative care sometimes needs to be with other specialities, and finding a place for palliative care on its own is challenging. And again, the evaluation as well, how we do that in terms of making sure that the evaluation for of what the curriculum manages to do is really important. So that's a quick trip around the EduPal curriculum, and that led to then the next steps in terms of the EduPal project, which Daniela will speak to. But this is us looking happy at the end of our first meeting because we were all just glad, I think, to get out of the, it was a hard 2 days thinking. And so the smiles on the faces, I think, is because, yeah, it was time to kind of take a break. So thanks. And again, I'm happy to take any questions, either just now within the webinar, or again, you can feel free to email me if there's any questions that you have you'd like me to address.
Thanks very much, Stephen. I don't see any questions. Does anybody want to type quickly? I was going to ask you a little bit, because at the beginning you spoke about the need and wondered if, in light of the COVID pandemic, you feel that that is an opportunity for palliative care.
Yeah, I think unfortunately it is in lots of ways, and I guess there are. I guess it's almost in a sense it's one of the areas where times where palliative care has been able to come to the fore and provide guidance to other areas. Certainly in our own clinical setting, I'm aware that we've been leaned on particularly heavily in terms of providing guidance, particularly around those conversations that people have, which I think is the challenge, one of the key challenges, but also the support that's provided in terms of having those discussions, and particularly, I know from colleagues who have difficult phone calls to make, but how they make sure that information is then translated through a family, for example, particularly where they have to then discuss with maybe younger children about what's going on. So I think, yeah, it does provide an opportunity to think about particularly the challenges within end-of-life care. And I guess it's maybe something within the curricula also we might need to think about in terms of the recommendations, is updating those recommendations to think about end-of-life care during times of a pandemic, because I think if you were to review this now, that would certainly be a gap. So that's maybe food for thought for us in thinking how we might move this forward.
Thank you. I think it's a really good idea. I was just thinking similar, that we wrote those in the old days and now the new normal. So we probably have an opportunity, and if more people had more education in palliative care, maybe things would have been better. Who knows? Anyway, that's my thoughts. So I can see, hold on, have we got some questions here? Let me have a quick look. Is there any paediatric palliative care included in the curriculum? That's from Karen Carr.
No, we haven't in this curriculum. We initially had some outcomes directed to paediatric palliative care, but I guess what we thought was that we wouldn't do it fully justice to have it just integrated, and actually what it could probably do with the development of its own curriculum and its own recommendations, just because of all the differences involved in terms of care. So again, there's another potential project for a group to become engaged with and develop. But yeah, there was a bit of a discussion about, but again, we didn't want to kind of do something by half and kind of look a bit weak. But again, yeah.
Okay, so thank you very much, Stephen. I know we've got time is not on our side already. And thank you for everybody new who's joined. We're up to 66 participants here at the moment. So I'm going to hand over to the project lead, Daniela Mosu from Romania, and she's going to talk to us about the EduPal experience, putting theory into practice. Daniela.
Thank you very much, Julie, for the introduction. For me, it is, I must say, I am really pleased to have this opportunity to talk about the work that we did in the project. And I'm also nervous because I hope I will do justice to all the work that has been done in the project, by presenting these results. EduPal for me is really important because I strongly believe that education is a way to develop palliative care in your own setting, in your own country. And I think to do this with students, it's really wonderful because at students level, because you don't have all the biases and all the routines, which you would find probably with other groups. Also, I believe that you can't just do theoretical things. You have really to do what you're preaching that you're doing. And that's why in our project, a part of doing the curriculum, what we have included is also to pilot and test this curriculum. So I would like to talk more about that part, and that's why I said from theory to practice. So in the EduPal, what is available? What did we make available? The curriculum, thank you, Stephen, for talking about the curriculum. The curriculum is available in English, Romanian, and German. But alongside with the curriculum, there are materials for the trainers that they could use to implement this curriculum in their own setting. So we have online courses, we have produced some training materials like lesson plans, case studies, exercises, mentoring toolkit, and these are some of them that I will show during this presentation, and Stephen will also discuss them in the second part of our webinar. You can find them all on our website on the EduPal platform. So now if we look at the curriculum and what we had to implement, there was, and Stephen presented already, there was a challenge with the number of hours. So we looked at the recommendations and then we tried to transfer those recommendations into a curriculum with its objectives and with the associated teaching material. And we came up with the 72 nominal hours. And this concept of nominal hours is very interesting. For Romania, 1 nominal hour is equivalent with 50 minutes. So for other countries, it's 45 minutes, but for us, to be clear, it was a 50-minute hour. And these hours then have been split in 3 types of learning. So 14 hours for teaching the whole group, so the whole group of students in a kind of more frontal teaching in a classroom format teaching. And then other 28 hours for teaching smaller groups in a seminar format or taking students in the hospice and to do really bedside training. And then other 30 hours were in an online format for individual study. So maybe it's easier for you to understand. This is how it was for Romania when I applied it in my university. The university was leading this project. This is the university that has for the first time in Romania included palliative care for students. And it was agreed that the university, being the one who's leading the project, to try to accommodate this piloting and really make the conditions for piloting so that we can test and see what is happening with the materials that we produce. So as you can see, the courses, these were the topics for the courses on the left-hand side. You can see every second week there were 2 courses, 1 hour each for the course, and each week we had 2 hours for seminars or bedside training. And you can see here in the middle, in the column in the middle, how I structured these trainings and what was the order in which I choose to do this training. The online was more used for individual study, and the way that I used it in implementing the curriculum was for students to, before the seminars, to prepare the online courses, to go through them, and then during the seminars, to use the seminars more like a kind of flipped classroom, during the seminars to go more deep into the concepts or try to clarify some of the concepts or do exercises or do the practical stuff. So this was the structure that I was using for the training. If we now talk about the online courses, during the project, we have developed these 15 online courses who are available to be used free. You can see here on the EduPal online. I hope you can see my screen. So the online courses, you have on the EduPal web just the topics, but if you want to view the courses, you basically have to enter here into this learning platform, and you create a free account, and here you have basically all the courses that we have produced. I will just for you to get a better grip of what I'm talking about, I will enter into the lymphedema course. Okay, I hope it's working. So this is the course. So it is user-friendly. The course is starting with the outcomes or the objectives that we want to the student to achieve, or the trainer, the learner. Some information with also images to help students remember about the positioning of the lymph nodes. Some exercises. In order to pass, you have to fill in to respond to these exercises. I will just pick one randomly, and then when you submit, you also have your answer and you see if that was correct or not. And here then you have explanations about each of the statements. You have also in the courses scales with images, or maybe more information on more complex issues, or a definition of terminology. In the assessment of, again, you can go in each of the elements and learn a little bit more. In order to see if you really have understood what you learned, you have case study. And in this case study, you try to apply, similar to the practice, your knowledge, and you have the case, you have the image, and then you have to, I don't know, respond. I'll just choose again randomly. And then when you submit, you would have again the correct answer. So I didn't choose right. You have also, for the management, again, you have explanation what each of these techniques are meaning. You can download, or you have references here, some exercises. You have the algorithm. This is in resources here. You can download your algorithm. This is an algorithm that is used in real life. We use it in the hospice for assessing and evaluating each of our patients and managing each patient with lymphedema, and of course the references. So I just wanted to show them to you so that you have a feeling of how these courses are structured. The students really like them. And of course, we have here also a place for feedback. You can give your feedback if you enjoyed or not our resource, and if there is an opportunity for you to use it, because it would be nice for us to know in the project if what we have produced is useful. So it's from basic to symptom management. You see, more knowledge orientated. So the online are more for for those part of the objectives which were more knowledge orientated. We have one which is also on grief and bereavement, emergencies, pain, symptoms. So this would be what we produced for online. The courses are both in English and Romanian. And for the Romanian part, they were transferred to all the universities that were part in the project. And this is the learning platform of my university, and how I structured them as courses. I put them together, the courses they had to read before in preparedness for this year. For example, these two they had to read when they were preparing for the seminar on loss and grief. Yeah, so I tried to organize them in a way that was making it easy for the students to understand what they have to prepare for each of the sessions. We had also, so those were the online courses. We produced also this trainer's toolkit. And in the toolkit, I will stop a little bit on the lesson plans. So taking for each teaching unit, here you have as a model limits and goals of medicine. So for each teaching unit, we did what were the outcomes, a kind of summary of the teaching unit, the objectives that we wanted to reach, the format, the learning methods, the format. So for example, for limits and goals of medicine, we felt that the best teaching format would be the seminar option. And also we put something called timing and the kind of proposal how the session could work. So for example, for this one, we proposed you could use a video from a movie, Emma Thompson, and then you, based on that video, to have a kind of open discussion with the students about the issues that are there, or maybe you could have structured questions for the students to answer. So this and of course the resources. This material is again available on the EduPal. And here you see they are organized. I was talking basically, sorry, I'm this one, goals of medicine with the lesson plan. And here also you have the other opportunity. So this is the book Watch With Me. You could use as pre-seminar reading and then discuss this with your students. Basically, the lesson plans are here. There are these 25 lesson plans. For some of, they are structured on the main themes of the curriculum. So basic palliative care, psychosocial and spiritual support. You have also some PowerPoints here, pain assessment and management, symptom management, ethical issues, communication, with family meetings where you have also some exercises, some self-assessment, some video links, then teamwork again with the PowerPoints. This is for English. For Romanian, they are put in this link here. I know we have some Romanian colleagues watching also the webinar. It's more like a booklet format. So who were those in my university who were receiving the course? It is a compulsory course in my university. It is in the fourth year for the medical students in the second semester, unfortunately. So it was interesting for the testing because we started as written on the paper and then we had to do a shift because of the Corona lockdown. So 92 students are enrolled and the semester has 14 weeks, and in each second week I had this theoretical training with the classroom teaching, and then each week I had 2 hours of seminar or bedside training. Initially we started, the students are coming, they are in groups of 6 or 10, they are coming to the hospice. But then we had to do these seminars, and it was a very interesting experience how this material is working when you use it not in the hospice with the patient, but in an online format. And of course, they had the online courses they had to study. So I will try to show you an example how I was doing teaching communication. Unfortunately, it wasn't planned in the initial month when we were face-to-face. It was planned to be taught during the lockdown. So we have this platform in the university, and of course we started with the course with 2 courses, one on active listening and empathy, and the other one in breaking bad news. And then we had 2 types of seminars, and this seminar, I will show you how I did it. These are my students, they agreed to be here. And I must say that I was really very surprised. I'm teaching doctors quite a lot. They don't like role play. The students said the role plays were the best things and the best way of learning. So you can see them here at the end of the session. They look quite happy. So we use Zoom because we couldn't be together, but we still had to go through the materials and we had to do the most out of the situation. And they had to prepare before the seminar. They had to do a self-assessment of their listening skills and to come with the results to the seminar. We were discussing the results, and some of them could see different shortcomings that they had, like, you know, one was more interrupting, the other one was tending to interrupt the patient, the other one to make early judgments. So we were discussing how could you try to overcome those. And then we used the breakout rooms. Zoom is allowing you to do breakout rooms, and we split the group into 3 students, and they had a scenario and a clear task for them as actors. So one student was the observer, one was the doctor, and one was the family member. And the observer, of course, had to observe the communication, verbal and non-verbal, and to provide feedback at the end. The doctor had to try to practice his active listening skill. And he had especially this kind of task to identify emotion in the family member and to acknowledge this emotion as normal, and to identify also the source of the emotion, and the family member just to present the problem and display emotion. Then we had the debriefing in the large group, and the same role we were repeating it so that every student had the chance to be doctor, family member, and observer. And at the end, we had a kind of, we were coming in the big group, and every student had the opportunity to say what he learned and what he's taking home as a message from the seminar. And the Breaking Bad news, similar, but the only thing is that in the press seminar, they had a movie and they had to reflect how the doctor in the movie was applying the Spikes protocol, and then we did again role play and debriefing and the learning points. So it was interesting that even, of course, there were drawbacks that we were not together, but still, I think we could do it, this education, even during the lockdown. We finished the course and they had to get a mark. So in order to assess them, we had all the objectives. For each objective, we had a kind of either a question or a vignette, or they had some activity in the practical exam. So here they have both a theoretical and a practical exam. And that's how they got their mark. But in parallel, what I tried to do is to see how they assess their own competencies. So on SurveyMonkey, we produced this survey where they had all the competencies from the curriculum listed, and they were requested to assess their performance at how they were able to do the competency at the end of the training, but they had to reflect what was the mark when they started the training and what is the mark now that they finalized the training. And also they had free text to assess the course. Assessing the course, they had overwhelming positive comments. And you can see I just took some of their quotes. So they enjoyed it. And the interesting one said, I was allowed to make mistakes without being admonished. So it was important for them to, it was also somehow during the communication, they felt they also were growing confidence. They liked the courses, they liked the interactivity, they liked the fact that they learned more about the symptoms. There were also negative things they were reporting, because I was asking also what was not okay for them. And a lot of them said, we would really, I mean, we enjoyed it very much, but we would like to practice that with a patient or see you working with a patient. So I think this is something we probably also how the education system is in Romania, this is very important. And also they liked very much the courses, but they would have loved to download, to have it downloaded, to read it, to underline it, to make notes on them and so on. So some said, I missed having a book with all the information. Also, they were saying, yes, it was nice to be together, but we always had to be on the computer. So this is again something we have to think in the future, if this is going to be the way we are educating. And also some said it is a lot of work compared with the number of credits allocated to the module, because the difference was that this time they had the online courses, and of course it was self-study, but if they didn't do the self-study, they felt really bad during the seminars where everybody has to contribute. So they ended up actually doing those and doing all those reading, and it was really, I mean, we measured it in number of hours, but it's very difficult to say if a student needs the same number of hours as we estimated for the online training. Where are we going from here? We are in the phase we have collected students' feedback. We will collect also teacher perspectives. From my perspective, I felt I didn't have enough time. So there were 72 hours, but still it wasn't enough time. I felt that for symptom management, we haven't put enough time, and I did more hours on symptom management than initially planned. I feel I would have needed more time for communication, maybe also because it was online. I moved some material into optional courses, and it was very interesting to see that students were coming to the optional courses as well, so they really liked it. I feel it is very important in Romania now. It is compulsory to have palliative care in all the universities, and I feel it is very important as we have this material. Of course, it can be used partially, it can be used as it is, but I think we need to train our trainers around the country. I felt for some of the topics I needed training, for example, for bereavement, I discussed before again with our psychologist to be sure I'm getting the right messages through. And I think it's important to share and enjoy and celebrate the work that we have done. I will end with this quote from Henry Ford, coming together is a beginning. And working together, staying and working together is a success. And this is the core group that has worked into EduPal. And I hope that what we have produced is really useful. I felt it was such during the training. So thank you very much.
Thanks very much, Daniela. I'm a little bit conscious of time, and there are a few questions in the box, but maybe you could answer those in text and people can read the answers. I just think it's important, and if we have time at the end we can come back to some of them. Is that okay?
Yes, of course.
Thank you very much. So on to our next surprise guest speaker, who is the editor of Journal of Palliative Medicine, Charles von Gunten. And Charles, we're really, really grateful that you could join us today at such late notice and with good news for us all. So you're very welcome. And I understand you're going to talk about the importance of early palliative care education somewhere in your 5 or 10 minute slot.
Thanks very much, Julie. So I'm Charles von Gunten, Editor-in-Chief of Journal of Palliative Medicine, which is a global peer-reviewed journal that especially serves the clinicians in our field. And as well, it enjoys being an official journal of the European Association for Palliative Care. As Julie and Daniela mentioned, I'm really pleased that Journal of Palliative Medicine has published the EduPal project description as a special report, and it is available online as of today, and it is also available free for today and tomorrow. The EAPC is disseminating the link, as well as if you went to Journal of Palliative Medicine on the web and just searched for EduPal, you would find it there. Now, there are two reasons in my judgment why it was so important to me to publish this in Journal of Palliative Medicine. The first is that undergraduate teaching in palliative medicine is so important because palliative medicine is now a recognized part of standard medicine. It's as standard as cardiology or surgery or obstetrics. So making sure that it is in the curriculum shapes the attitudes and the expectations of the medical students that become the future physicians that will take care of all of us. But the second reason that it's so important to me to have published this is the establishment of one voice, one standard of medical education. You all are as aware as I am of how variable specialist palliative care is across Europe and around the world. The fact that you went to the European Commission to get an Erasmus Plus grant, and you put the hard work, and I emphasize very hard work, to achieve consensus across Europe with all the barriers that are there. That methodology and that model is useful around the world. Other continents can use the way you did this to improve palliative medicine education and the palliative care given around the world. So congratulations on the work. I'm delighted to be publishing your special report today. Thank you for the contribution to the world scientific literature, strengthening the preparation of physicians, because they will look after us and our families when we need them. Thank you very much.
Thanks so much, Charles. Really, really very much appreciated. And we know you pulled out lots of stops to get that published and free to access for the next 48 hours. So people, please download and take advantage of that. It's such a great offer and such a fantastic resource for us all. So thank you, Charles, for making that effort. We really appreciate it. Our final talk for this webinar is back to lovely Dr. Stephen Mason, who's going to talk to us this time about developing a mentoring program in palliative care undergraduate medical education. Please let me remind you, if you have questions, type them into the box. We will answer all of them. If not immediately, you'll get an answer, I promise, from Stephen, from Daniela, or from me. So please type in your questions. And now over to Stephen.
Okay, thanks, Julie. I will. Can you see my screen? I'm not sharing it. Hold on. Hold on. Let me share. Okay, this one, I think. Okay.
Yes.
Okay, good.
Perfect.
Okay, I will try and speak a bit slower than my first presentation. I think I probably spoke very fast. But yeah, so, oh, this is the wrong presentation. Hold on a second. Let's get rid of this one. Oh no, that's all right. Okay. Okay, very good. Can you see my presentation? Yeah?
We can see it, but you've got it on slide sorter,
okay.
so just need slideshow.
There we go. Okay.
Great, thank you.
So, yeah, so one of the outcomes from the EduPal project was to think about how we provide support to students who are learning about palliative and end-of-life care. And it's particularly important when we think that for many of these students, they will have a number of challenges that they're facing, and that when we are training them about these issues, which can be challenging and difficult, that they have appropriate resource to get support where required and appropriate guidance. And most mentoring is one of the ways that can be done. And I guess most mentoring programs or mentoring relationships tend to be a little bit ad hoc or informal. And so we thought we would try to provide an outline for how mentoring may be implemented and structured within undergraduate training. So this is again a very brief overview of that, and I will refer you to the website for further information. So you'll see on the website we do have what's called the mentoring toolkit, and again this is 5 separate chapters which cover a whole range of issues around mentoring, from what mentoring is in terms of definitions and models that can be used, to developing a mentoring program, which is what I'm going to speak about shortly, to practical skills in mentoring. And again, if you log into the EduPal website, you can see each of these chapters, and they are, I put them on screen here so you can see them. They're workbook-like chapters, structured in a way where there's an overview of the evidence and the literature around mentoring. There's some reflective exercises that you can engage on, or that you can use with students to kind of think about what mentoring might look like. There's some guidance around models that can be used, and there's also some linkage to assessment tools that you can use when you need to think about matching within your mentoring process. Before I speak about the developing a mentor program, it's just to say that I'm doing this because we've been very lucky here in Liverpool. We have an amazing MD student. It's Associate Professor Lalit Krishna, who's probably one of the world's leading experts in mentoring, and he's been working with us here in Liverpool doing his MD. And I'm basing a lot of what we're discussing and how you set up a program on his work. And again, actually, it's quite interesting when you look at mentoring, there's not a huge amount of work that's been done looking at mentoring within palliative medicine training, which is very odd considering the challenges that we have within our training programs. But again, there's just some of the papers that Prof. Krishna has published recently. I particularly refer you to the top paper there in PLOS Medicine. But again, so it's just to kind of say that the work that I'm citing today comes from his work. So, and he's a good guy, well worth getting in touch with. So as you say, mentoring, most people's experience of mentoring is largely informal, although there are formal mentoring programs that are available. And again, there are advantages and disadvantages to both formal and informal mentoring. With informal mentoring, which tends to occur, I guess the beauty of it, or the advantages of that, is it tends to be organic in its development, where a mentee will link with a mentor and arrange for that relationship to develop. But again, the problem with informal mentoring relationships is it doesn't enable all students or all potential mentees to participate. And because of that, often the students or the mentees who would benefit from mentoring miss out. Formal mentoring programs are much more better in that sense, because it allows us to structure what's going on and actually look at the outcomes from mentoring programs and have clear boundaries regarding the relationships within mentoring and what those objectives are. There are some disadvantages to formal mentoring though, in terms of making sure there's sufficient capacity within the faculty for that, and actually there's sufficient interest as well. So I'm going to give you what's Lalit's kind of 3 top tips for thinking about, if you were to develop a mentoring program, what are the considerations that you need to engage with. So the first thing to do is, if you're sitting there within a faculty and thinking about, oh, how do we provide mentoring, is to engage in an organisational review, and is to look at what currently goes on within the medical school or the department where you're engaged with. And that involves looking at existing mentoring programs, or it might not quite be a mentoring program, it might be something similar, but it's looking to see what's available in the environment, because you may be able to adapt or expand currently something that's already there, so part of that hard work is done for you. For programs that are already in the environment as well, you might want to look at what lessons have been learned from those programs, and there may be real strengths that come from that, but you might be able to identify some weaknesses as well. And again, one of the things you also need to look at is what is the scope for mentoring. So at the university that I work at, the University of Liverpool, we have a program where students are allocated an individual tutor that follows them through their 5 years of training. But again, a lot of it is dependent on the nature of the relationship between the tutor and who's allocated as the mentor and the mentee. And again, from students that I speak to, some of them have very good relationships. They've really benefited from their mentoring relationship. And for some, it's been largely absent. So again, there is something about how the nature of programs that are currently in place can potentially be improved or adapted. You need to think about the resources that are available, and that's everything from administration resources and technology and funding to the availability of mentors as well. And I guess we need to think about, particularly for palliative medicine, where students may have been allocated a mentor in another area or another department who may or may not be comfortable with actually discussing palliative medicine or the challenges that come up for it. So again, a real thorough review of what's going on within the department or within the school is required. And equally, you need to think about a mentoring champion. So much as we were talking about earlier within the curriculum, you may need a strong advocate within the medical school, someone in a very senior position to argue the case for the inclusion of palliative medicine within the curriculum. Similarly, you will need something similar in terms of mentoring program as well, because if you're trying to set up a mentoring program without that senior level investment in terms of time and resources, it's unlikely to survive. And again, what that senior person may do is potentially act as a role model for other senior clinicians or senior members of the team to provide that example of how mentoring may work well and how it may be developed. So once you've done your organisational review, then you need to think about how you're planning your programme. And again, like any kind of standard planning cycle, there are key sections and key elements you'll need to think of. And you clearly need to think of what is the aims of the programme. Is the aims of the programme satisfactory student progression, or is it something more holistic in terms of its focus, in terms of the development of the student as a doctor or as a rounded clinician? So it's really important to think about what the aims are and to think about what the underpinning philosophy behind the programme may be. You need to think about the programme structure as well, and so that may be thinking about a code of conduct and formalising what the nature of those mentee-mentor relationships are. And you need to think about the recruitment of mentors and actually who can be mentors. There will always be a balance between the number of potential mentees and those people that can act as mentors. So thinking about different approaches such as peer mentoring or near peer mentoring are ways that you can maybe think about sequentially developing a program that can move forward as it develops through time, and the benefits of the mentoring program are seen. Training is really key as well. Again, it's a lot like education in lots of ways, and people think because you're a clinician that you can just start teaching, and actually good education practice comes from considered development and an understanding of pedagogical theories and how they work and what works best. Similarly with mentoring as well, mentors and mentees need training on what that relationship is and what it involves. And again, there are elements within that in terms of how you think about mentor and mentee matching as well, and that's about maybe preparation. So it may be potential mentors will have a small biography that mentees can review and look at and think, do their interests match what the mentee does? Again, there's some evidence that shows that actually if you match mentors and mentees according to common issues such as gender or ethnicity, then that can have benefits as well. And again, thinking about a program, you may want to enable a trial period where the mentoring relationship can be reviewed after a small period of time, and enable mentors and mentees to kind of say, well, actually, this isn't quite working. Maybe we should try something different, or try a different mentor, or a different group of mentees, because it's not always going to be successful. So planning thoroughly what that mentoring program or that mentoring relationship might look like is really kind of important. And then once you've done your review of the organisational review, that will also link into programme support as well. And again, it's really important that there is structured support in terms of the mentoring programme. It needs to be seen as a strategic priority. And again, without it being seen as a strategic priority, there's likely to be not enough investment to make sure that programmes are maintained and survive. And within that, there needs to be sufficient support for mentors and mentees in some programs. So in the palliative medicine initiative that Prof. Krishna has developed, I think there was support in the way of that those senior clinicians that acted as mentors got additional access to funding for publications and for research support. So again, it may be that the clinicians that already have busy timetables is how do you provide them with an incentive to make sure that they provide appropriate mentorship. Key within that program support is also kind of the review and evaluation of what the mentoring relationship has developed and what the outcomes of those as well, and thinking about how you will respond to challenges. So again, there's more detail within this and within the mentoring handbook. Again, I quite like this diagram, which comes from one of Prof. Krishna's earlier papers, which is called the mentoring pyramid. And again, it's just a useful kind of image to think about, that mentoring relationship is much just more than just a dyadic relationship between a mentor and a mentee, and whether that's an individual mentee or a mentee as a group of people. There are a number of factors that need to be considered in thinking through a well-developed approach to mentoring, and that's mentee-related factors, mentor-related factors. There's the organisational considerations to think about in terms of what's required. There's the nature of the relationship and how that will develop. And then again, the evolving conditions is actually the department and the transitions that are made through the programme. So I'd encourage you to go have a look at the guide on the EduPal website. And again, just to kind of say it is, I think it's a really key issue. We in Liverpool, we're lucky enough that education in palliative medicine is mandatory, and all fourth-year medical trainees come through our unit for 3 weeks training in palliative medicine, and they come in blocks of 30 students. And in each block of 30 students, there's always usually 2 or 3 students that have either had a recent bereavement, have a family member who's very ill, or have challenging health issues themselves. And again, it's really important that we pick these students up so that we're not adding to the stresses that they already have, and that we can provide them with an experience which allows them to learn about palliative care appropriately without challenging them in other areas and adding more stresses to them. So again, it's really important if we think, well, if we are teaching and enabling learning around palliative and end-of-life care, that we actually have enough support for those students that they can do this appropriately. So again, I'll refer you to the website, which Danielle has shown you there. Again, if you log in, you'll find the information on mentoring in the educational resources. And again, as before, I'm happy to answer some questions if you have them now, or again, you can email them later. So thank you.
Thanks very much, Stephen. I'm very aware that we are at 4 minutes past 5. I think there's a couple of questions in the chat box, but no others. So I'm really keen not to keep people running over on time. I'd like to thank Stephen, Daniela and Charles for being a part of this first webinar. I want to remind you that there are 2 further webinars tomorrow and the following day at exactly the same time. You need to register. If you want to download the paper that Charles spoke about, you can go to the EduPal website, so you only have to Google that. If you're on Twitter, please tweet and tell us what you think of the webinar, and let people know about the ones tomorrow, so you can retweet from the EAPC website. There's an evaluation that we would really be grateful if you could complete, please. And we'd like to thank everybody for participating, and thank you for spending the last hour and 5 minutes with us. I'm sorry we ran over slightly, but I hope we answered all your questions. You can email any of us directly if you have any additional questions. And as I say, we have 2 more webinars, so please take the opportunity to join us again for the next 2. And on that note, I'll say thank you and goodbye. So thank you.